So this is the Law Enforcement Community Engagement Committee of Hancock County. And we are hosting a talk and discussion today with Nick St. Louis, who is the Community Liaison for Substance Use Disorder and the Options Program, which stands for Overdose Prevention through Intensive Outreach, Naloxone, and Safety. And after Nick's talk, we'll have time for questions and discussion. And Nick, we are so glad that you're here.
Thank you very much. Am I able to share my screen?
I can set that up. And Glenn,
Okay.
we're so glad you're here.
I'm not sure how I can do it. Start out as
Let's see. Da, da, da.
I just have a brief PowerPoint and then we can have some questions if you have any.
Sure. And I'm so sorry I missed you going around doing the introductions. How could I have done that? There, you should be able to share your screen now.
Okay, let me see. Perfect. Oh wait, that's the wrong one.
Terrific. That's working.
Okay, good.
I probably live about a half hour. So that's nice. Sure.
Can everyone see it okay?
I'm seeing a dark gray square. Whoops, and now it's back to your folder.
Really? I see the PowerPoint. So let me.
We're still seeing your PowerPoints folder.
Thank you so much.
Small presenter view, and there we go.
Me too.
Can you see that now?
No,
What?
it's still just the folder.
Let me try again.
I like hands-on. Yeah, I like being a part of it. So that's going to be good. I'm looking forward to it. I'm really
Okay.
All right, Miss Polly, thank you for calling me back.
Can you? Okay, hold on.
Thank you so much.
Can you see that now?
You too.
Now we're back
no,
to our regular.
Now it said shared screenings window is closed. Gosh, let me. There we go.
I think it can. Sometimes it helps if. Oh, there you go. Now you've got it.
Okay, perfect. There. Can you see that okay? Okay. So options, 3 counties that are run by AMHC are me and Hancock County, and then we have Washington and Aroostook County. And you kind of went over this, Shamaya, but options stands for Overdose Prevention through Intense Outreach, Naloxone Safety. It's a grant provided by the state and the Office of Behavioral Health that has partnered with AMHC and various other crisis service agencies throughout the state. And where substance use clinicians embedded with law enforcement is how the grant was written. It's a co-response model, although a lot of us aren't co-responding yet. And the counties are so large, it's hard to co-respond in time with an overdose. Outreach, we do outreach and provide support to community partners. I do a lot of distribution of Narcan and harm reduction supplies, including fentanyl strips. referrals to syringe exchange programs, such as Health Equity Alliance that we have in Hancock County. I provide trainings for law enforcement and the community, such as these and other committees, and then help connect individuals in need with resources to improve health and therefore improve the health of the community. We provide connections to treatment, recovery support, and other community supports. We do not provide substance use treatment, and we do not push people into recovery or treatment or anything. We meet people where they're at and start there. And this is the co-responder model. Do you guys see that on full screen? No? Okay. I don't know how to make it like that. So it's probably small. But anyway, we're the hub. It's a hub and spoke model. The liaison as the hub, and then we can refer to treatment, recovery residences, recovery coaches. We're working now towards focusing on getting into hospital emergency departments and connections through EMS. They're working through modules right now that kind of gets us around HIPAA. That's been the whole thing with the medical providers. We can get people in rapid induction in emergency rooms, so on Suboxone, so they can get into a program. It usually takes 2 or 3 days, so the ER can provide that amount of medication. They make somebody go in every day for 3 days or more until they can get into a Suboxone program. We also do connections with syringe service programs. We do a lot of Narcan distribution and trainings. ODMAP, we participate in ODMAP, and if people don't know what ODMAP is, it's a national database where EMS and law enforcement, if they're set up, it's a opt-in program. We can see live, well, as soon as they're entered, there's maps of the whole United States, and we can see where overdoses happen anywhere. But in Hancock County, I check once a week, and it'll list whether or not the person was given Narcan, how much Narcan, what drugs are on board, and who dispensed the Narcan or who transported to hospital. And then we can follow up with them if we don't get the referral. We also support people in applying for main care. Everybody we come across, we help apply for main care, even though there's no cost to my program. We don't bill insurance, we don't bill people. And then we have the law enforcement diversion program, which we don't really have. We have the Project Hope and programs like that, but they're hoping to do LEAD again, which keeps people from the criminal justice system and diverts them into behavioral health before arrest. And then the reentry programming with the state prison, they do that in Waldo County. We don't have a reentry center up here. And then of course, opiate and, oh, I already said that anyway, substance use treatment. So we have a contract again with the Office of Behavioral Health to provide liaisons, Hancock, Washington, and Aroostook counties. Our law enforcement partners are all of those so far. In Hancock County, we have the embedded preferred agency, I guess I should say, is Hancock County Sheriff's Department for us, although that's not happened quite yet. And then each county has sheriff department as embedded, but most of us are embedded with the smaller, or I should say connected. We're not really embedded with the smaller departments, and we have Bar Harbor, Bucksport, and Goldsboro so far, and the other 8 counties are contracted with other crisis agencies around the state. This is just a list of all the liaisons, which I can provide if people are interested. And these are just some statistics on overdoses that you can probably hardly see. And I can provide this PowerPoint also to everybody if they're interested. So this is, like I said, a co-response model in theory. And then when timing and safety allow, we would respond with law enforcement and or EMS to the scene of an overdose. And if somebody, refused medical transport, we would kind of sit with them, try to get them whatever services they're interested in. Or if they are transferred to hospital, then that's where we're trying to get into emergency departments and more embedded with EMS. That just makes a little more sense. We can provide support in real time and offer other services after a life-threatening event. And then we can also provide for support to family affected others, first responders, and anybody can refer to me, family members, law enforcement, EMS, concerned community partners, anybody. There's a place on the website that's going to be coming up, or you can just email or call me too. With all I need is name, phone number, and an address, if they'll provide that, and whether there's any safety concerns for me to be responding to the household if I can't get a hold of them. And we're tasked to getting to know our communities, raising awareness, providing outreach to at-risk populations. We're, in theory, we can do drop-in hours at schools and agencies, which I do drop-in hours right now at Bar Harbor Police Department and the Inspire Recovery Center that we have in Ellsworth. We can work with community resources to connect more individuals in need. I am part of a lot of these community meetings and collaboration throughout the county. We provide a lot of community trainings about stigma, naloxone, and harm reduction. There's the coalition meetings, and then local events such as health fairs. And that we did. I've done Blue Hill Fair. We're at the Blue Hill Fair. We recently did a health fair in Blue Hill a couple of weekends ago, and then we do drop-in hours at GSA last summer and this fall to provide Narcan trainings to the students. So a little bit about harm reduction. It's defined as a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief and respect for the rights of people who use drugs. Connection is one of the most important ways we can help individuals who use substances by focusing on harm reduction and providing a space that allows for honesty and connection. And that's the biggest part of my job, is developing relationships and trust with folks. And that's why I think it makes a little more sense to be connected with EMS and hospital emergency departments, because a lot of folks using drugs, of course, don't want involvement from law enforcement. It's intimidating, and it's just typical response. And the harm reduction includes abstinence, but it's definitely not limited to that. It's meeting people where they're at, but not leaving them there. Acknowledges the middle ground between abstinence and out of control use, is aimed at keeping people alive and protecting their health. People who are dead can't recover. And celebrate small changes. It's important public health strategy as well, because a healthy drug user is a healthy community. And financial benefits, of course, the recidivism through ERs and homelessness and jail is pretty expensive for the county. And its harm reduction looks like many different things. It's needle exchange programs, distribution of safer sex items, condoms, etc. Fentanyl test strips, Narcan. We can refer for HIV, AIDS, STI, hepatitis, and other health conditions. Of course, supervised injection facilities, which we don't have in Maine. We just were allowed to have them in this country if they're sanctioned. First one was in Pennsylvania, and they have one in New York, I believe. Currently, our governor is not on board with these anyway. And then we can get people into treatment, medication assisted treatment like methadone, Suboxone, Sublocade, or Vivitrol, and any other low barrier services. And then this is also harm reduction. People don't think about harm reduction every day. You know, wearing your seatbelt and wearing a life vest is reducing the harm from drowning or an accident. The part of our Narcan distribution is we do a brief 5-minute training. It takes no time at all. And then you are able to administer Narcan to anybody that can. We hold trainings. Does everyone know what Narcan is? It's the overdose reversal medication. Okay. In order to give out Narcan must be trained in its use, which we're trying to waive that part of the law, because anybody should be able to use it. It's very easy to use. And there also are Nalox boxes now, which are vending machines for Naloxone that anybody can get that. They're placed throughout communities. I think they have one in southern Maine somewhere so far. And of course, it's free of charge, and we don't have to document any information. And then referrals, you know, I mentioned this a little bit, community members, concerned others. When we receive a referral, we reach out to the individual as quickly as possible to start building that relationship. We have 24 to 48 hours, and then 72 hours on the weekend. But we all basically get to them as soon as we can. Anybody can send a referral going to our website and then clicking on, which is the next slide, I think, clicking on my name or right to AMHC website. There's a link. So this is the Know Your Options website. And it has a lot of information, stories, preventing overdose, resources. This is what the liaison part looks like, and you can see, or can't see, but you will be able to see. This is my contact for Hancock County or any other county. You click on this link, request help, and it will fill out the community referral form will be there to fill out. And then that's it.
Thank you very
You're
much.
welcome. You're welcome.
And I wonder who might have questions.
And I'll also provide the PowerPoint, like I said, for folks to see a closer view. It was kind of quick. So
Yeah, we could put that in the follow-up email.
yes. Yep.
And if you'd like, that could go out to the full LECEC list, which
Of course.
kind of helps the word get out farther.
Absolutely.
I wondered if you might say more about the thing about being embedded with different law enforcement departments and how that's coming or how it's working where it is happening.
So the program was written as co-response, and being so like some liaisons have radios, some liaisons have black jackets, and they do ride-alongs. And then, like I said, I go every other Friday. I go to Bar Harbor and have in office hours. I just sit there, meet with all the guys if they have any referrals or if they've had any issues, and I basically just sit and do my work. Honestly, they don't have a lot down there, but it's just building that relationship and knowing who I am. And now I do that with John too in Southwest Harbor.
Mm-hmm. That's great. We had a talk by folks from Waldo County who talked about their program where they have a mental health professional who does go along with them.
Bar Harbor has that now as well. We have a contract through AMHC. They have a 40-hour position for our crisis worker now who does a lot of that. Yeah.
That's great.
Yeah.
Glenn, is anybody thinking about that in Ellsworth at this point?
I have contacted maybe Chief Mosier can say more.
Yeah, I mean, but we haven't had any, we haven't had any agencies that have actively pursued working alongside us currently. The reality of what Nick's talking about is it's kind of ridiculous to think that one person could even remotely cover the entirety of the county. I mean,
Right.
you need, realistically, if the state wants to enact a program like this, they need to have many more liaisons assigned to individual departments, not counties.
And that makes a lot of sense.
I mean, it's absurd, and the concept of a co-responder is absurd if you have one person who's spread out throughout the entire county. I mean, we never know when we're going to get an overdose call. We never know, when we're going to get that person in crisis call. So for us, when we respond, to try to track down a liaison who may or may not even be, in the vicinity, is just kind of ridiculous as a true co-respondent type of philosophy or effort. Plus, with our county, Nick is relatively new. We've had some. We had an initial liaison who we met and started to build relationships with, and then she left, and then there was a long period of time without one.
Right.
So the program, I think it's been in effect now for going on 2 years.
Yeah.
And it just really hasn't come to fruition here in this county. And based on the size of the county, and the distance to cover, I just don't know that one person can ever really have an impact.
And that's what they're looking at right now, is providing extra liaisons through counties, especially the larger counties. So I don't know if that's something that's going to happen. Becky?
Oh, okay. 5 questions all jumped in there. So is this a is this a state program? Is this funded by the state?
Yes, the
Your
Office of
salary's
Behavioral
funded by-
Health.
Through
So
what?
they provide my grant to AMHC, and I'm actually paid through AMHC.
Which is what?
Oh, Aroostook Mental Health Services.
Okay.
Sorry. Well, center, but Aroostook Mental Health Center.
And has anybody in this organization approached the county commissioner of Hancock?
I honestly couldn't tell you that. I have no idea.
And then moving on into sort of community marketing. I don't know what else you want to call it, but is this effort doing any kind of education of the public, marketing it?
Well, I do a lot of these community coalition meetings. I also have posters and stuff like that.
So that
business
is
cards.
your job.
Yes. We are pretty lucky in Hancock County to not have overdoses like they have in Bangor and Penobscot County and Portland, where liaisons are responding constantly.
So I'm
go ahead.
wondering, I'm being involved in Blue Hill local politics, government, I should say, not politics. I am not political. I'm concerned with government. Okay, there go all the questions again. I can't remember. Sorry, I'll come back.
Okay.
And Glenn, I wondered if you see it, because the county is so broad, like, do you look at doing something just within Ellsworth? Or, and like.
Yeah, I think, Ellsworth's large enough, and that has a population, our homeless population has grown, our mental health population, we deal with a lot of the mental health from throughout the county that end up at our hospital. We're clearly large enough and have enough call volume to justify and to support probably at least embedding a mental health professional into our agency. And it's something that is on the horizon for us. It's not anything we have budgeted for right now. You know, based on fiscal restraints, you know, for our city and sort of the uncertainty of the, you know, the economy, there's certainly some hesitation to, you know, to add any additional expense to any department, let alone, you know, the police department. So it's
Right.
certainly something that's in our future to have working alongside our officers in an effort to reduce the, you know, the strain and the responsibility, if you will, of the officers, but also provide a better service to the community and those in need. So I think, you know, I think realistically, the county, certainly Hancock County Sheriff's Office, as they look and probably over the next few years, they're going to have to expand their patrol service because the state police call sharing is kind of going away. It's likely in the future to be a thing of the past. So I think the county agency is certainly large enough that they should be looking to add their own support services built right into their agency. You know, it's really, Bar Harbor certainly has the money to be able to pay for their staffing if they, you know, if they saw fit to do that. I see it really as more of an opportunity for the smaller agencies, the Gouldsboroughs, the, you know, Southwest Harbors, even maybe someone like Bucksport. One, they don't have as many opportunities or as much need as the bigger communities do. And two, they don't have the resources necessarily to be able to fund it themselves. So I think the Liaison program, you know, absolutely has validity and can be, you know, can be a valuable tool. But I think it's up to the bigger communities and the bigger agencies to kind of take on the role themselves and leave the liaison to help those who really don't have the ability to, you know, provide it for their community. That's just my opinion, but.
So I noticed that there's sort of hub centers of need, and they tend to focus around the large communities. And I, as a Blue Hill person, am aware that we as a local community do not respond to our stressed people, that we tend to send them over to Ellsworth and Bangor or just let them go or push them out. And I would love to see some kind of consciousness raised by these small towns that I call it small town drift. You know, they just drift their problems over to the bigger cities. So, you know, to have some kind of consciousness of a larger money pool, you know, and to add to those things, but that's obviously in the future.
Yeah, money's the biggest problem everywhere, as we know.
Well, I would disagree a little bit with you, Nick. I don't think it's necessarily always money as much as it's priority. And
yeah,
you have to, you know, you have to prioritize your spending, and yeah, there's a limited pool of money for, you know, every community has, but
right.
Once you prioritize what you want to spend that money on, then that's, you know, then it becomes less of an obstacle. And I just think that, you know, like a lot of things, Maine is slow to react, and you know, and our priorities are slow to shift towards offering this service, you know. And in Ellsworth right now, I mean, we're struggling with EMS. I mean, that's our biggest
Right.
struggle right now is providing EMS service to our citizens. And you know, once that's kind of our priority, kind of our focal point. And I think once
Right.
we are able to achieve some level of consistency and confidence with that, I think this is kind of our next hurdle that we're going to have to tackle, and there's going to have to be some priority given to, like I said, embedding within our police department or maybe our EMS response, you know, a level of service that currently we don't provide. And we've tried in the past. I mean, I've been very involved and active with AMHC to get folks, you know, crisis folks to be able to respond with us when we go to calls. But, you know, like I said before, we never know when we're going to get those calls. And usually by the time we get those calls, it's a crisis immediate response that needs to happen now. We can't be, waiting for a crisis worker to be able to, travel from Harrington or something. I mean, we've had, we've experienced some pretty unique situations in this county with that type of.
Great. I am cross-training now for CSP for crisis work. Actually, they've made us all train for that, which has been very beneficial.
And what does
Nick,
that stand for, CSP?
Oh, crisis service provider.
Okay.
where do you reside, Nick?
I live right in Otis.
Otis?
My office is in Ellsworth though. So yeah, it's like, 20 minutes, 25 minutes to get from my residence to anywhere, really, 20 minutes. So yeah, it's the biggest issue with us in corresponding is the distance, especially in Aroostook County. I mean, that's like impossible. They have two, but
Yeah, and I mean, when you think about co-responding, you think about a 20-minute response time. I mean, the reality for us, most of these situations are resolved inside of 5 minutes.
right, and they have to be, right? So
yeah, I mean, we get on scene if someone's overdosed, we're administering Narcan, and typically trying to get them to go to the hospital. I mean, just last week we had 2 overdose Narcan deployments, and both refused treatment, so they weren't transported. But after we administer the Narcan and they're checked out by EMS, I mean, essentially at that point, that's the extent of what we can do for that individual, outside of make a referral and Nick follows up later on. But
yeah,
but our total time spent involvement's under 10 minutes.
right.
And when you get to a crisis situation, so not necessarily a drug overdose, but a crisis, typically by the time the police are called, the person's in full blown crisis, and we're getting there, and in some cases, unfortunately, being forced to restrain the individual who may be trying to hurt themselves or others, and looking to immediately transport them to a medical facility where they can either get medicated or begin the process to see and talk to someone, a crisis worker. So
right.
those situations are typically resolved, like I said, inside of 5 to 10 minutes at the most. So a co-response from someone coming from 20 minutes away,
Right,
not likely to be real productive. So,
and that's why we're trying to get into emergency departments too, to be able to follow up after transport and all of that, because it makes a little more sense. We can't do a response in the moment a lot of the time.
Yeah, and I would just add to that, I would just bid you good luck getting into Northern Light. Northern Light,
yeah, I know,
is extremely difficult to deal with. The state, so for law enforcement, the state has kind of tied our hands when dealing with mental health folks and folks in crisis, and they've tried to, or not tried to, but they would, they encourage, obviously, when we take someone into protective custody, not encourage, we're required by law to take that person to a facility where they can get, treatment. And Northern Light will frequently, when we call and advise them that we have someone in crisis, they've oftentimes tried to divert us to another hospital because they were full. And then when we get there, we get very little cooperation from them, and so they've proven to be rather difficult to deal with. Also, when you look at the state, they passed the yellow flag law, which is about gun confiscation from folks who are suffering from mental health and in crisis. And Northern Light flat out refused to engage in that process. And part of that process is the doctor was the one that was initially supposed to sign off saying,
Right.
yes, this person should not possess weapons. And that would enable law enforcement to go and seize those weapons.
Right.
And Northern Light, all their facilities from their corporate level down said, no, we won't do that. And so
Wow.
that's created, and Northern Light wasn't the only hospital, let me just say
Right,
that, there were others
right.
as well, but that's created difficulty in utilizing that law to get guns away from people who are potentially dangerous. So they're difficult at best. So I think I think you've got a uphill battle to try and get them, to cooperate, especially because they hide behind HIPAA all day, every day.
Uh-huh.
And they will, they'll continue to do that, I'm certain.
Yeah, that's the problem we've had since day one. And that's why they've been successful, and it's an opt-in program, but EMS is going to be able to do, it's going to be in their workflow to do a referral to options automatically when they have an overdose. So that's how they've kind of gotten around that in HIPAA. But yeah, Northern Light has been extremely difficult.
Well, the state should make a mandatory reporters. I
Right,
mean, they have mandatory reporters for child abuse. They're mandatory reporters for dog bites, for crying out loud.
right,
If you have to call the police because someone was bit by a dog, why in the world wouldn't you have to notify, maybe not law enforcement, but maybe it's a crisis or a liaison like yourself of a drug overdose? I mean, that's
right. So I mean, it just makes sense. So hopefully that's what they're doing. They've distributed training modules, and they're supposed to be doing that, but still, like I said, it's an opt-in program, so it's not an opt-out. That means they have to choose to do it. They have the choice to do it, which has been the problem from the beginning, because they're given that choice.
It's an
But-
opt-in program for the healthcare provider.
for the EMS to do a workflow, to include us in the workflow for automatic referrals. So that's just being rolled out soon. We'll see how much participation we get and see if they'll make it opt out. But
So part of your problem is how much territory there is to cover, and part of the problem is even having access to the folks who could use your services. Am I getting
correct.
that
And I
right?
don't even know if I warrant enough calls or referrals to get a second liaison yet. That's the problem.
Back to rolled out. What do you mean rolled out?
They're in the works of getting trained to be able to getting trained to change the workflow and be able to do the referrals and how they're going to be doing them, I guess. So they're
And that's-
working on the training now. EMS, yes.
And that's EMS, okay.
Yeah.
And Maggie, I wonder if you've been having thoughts about this related to dealing with domestic violence situations.
I honestly don't really have a lot of input because we have my work specifically, I don't typically encounter things like that. Generally when people are calling us, they're in crisis already. So, anytime that there's something that we're not specifically dealing with, like in our agency, we would refer to AMHC. We do have a pretty good relationship with them. But I don't really have anything specific around this.
All righty. And Jennifer, I wonder if you've been having thoughts as this has been going on.
I do have lots of thoughts, but I think I'm just gonna not share them right now.
Oh, Well, if you change your mind, it's always good to hear somebody's having a lot of thoughts, and it would be really interesting.
Follow-up email maybe.
So like a
Um,
good bean supper, the beans need to be soaked overnight.
Yes,
I just think that this program, the Options Liaison, is an amazing program. It is taking a little bit to figure out how to integrate it with everybody. People, I feel like, need to be really open-minded and willing to try something new before forming opinions. So I'm just interested in helping Nick along with his program and seeing what it's going to manifest into.
Thank you.
Nick, do you have, or does the people you work for, do they have success statistics yet on being a data-driven person?
we enter data every month to the state. I can give you that data is on main data drug hub.com, I think it
Thank you.
is. And that's all. There's a section for all the options data on that website throughout the counties.
Oh, options data, okay,
Yeah, through all the counties and the difference between counties.
okay. Love that data.
So, if there's no other questions or does anybody else have questions, we have
Well-
to go to treatment court.
Suzanne, did you have thoughts?
Well, I remember when the governor came into office and, all these people were dying of overdoses and all this stuff. There was a big furor, and she convened that big group to sort of look at all this. And I guess this options program came out of
Yes, it did. Yeah.
that work. And so I'm just curious on that level of like the governor or whatever. Has there been any evaluation yet, or is the program still too young and still trying to get itself going to find out?
There's a little bit of both, but that's she loves this program and she thinks we need more liaisons. So that's why they're trying to fund this year. They're trying to fund more than one liaison in each county because they want they see the need for that.
Mhm. Right. So the overdose numbers, I mean,
Are
I'm not
still
familiar with it.
increasing.
Are they
had-
increasing?
Yeah, we had 716 last year, which is a 13% increase from the year before.
Okay. So,
Statewide,
so
statewide.
yeah. So we're a long way from
Better. Yes,
getting better.
unfortunately. Yeah,
Yeah. Okay. Well, thank you, Nick.
you're welcome.
And if you were going to pick, what's a priority like for action going forward that maybe the community can be supporting what you're trying to do? What?
Just getting the word out. It's
Mhm.
still, like Glenn said, I'm still brand new. I've only been doing this 8 months. So I'm on track to technically what I'm supposed to be doing and how the word's getting out. It has been going for 2+ years and the agency has had trouble keeping someone in the position. So that's why I have to keep rebuilding I have to rebuild all the relationships that were built before me.
Yeah. Yeah.
So that's what I need is just word of mouth, getting out there that there is the program and getting buy-in, really.
Mhm. From like law enforcement.
Law enforcement,
And
EMS, other
EMS.
agencies.
Mhm.
EDs, hospital EDs, yeah.
Yep.
So
Okay.
we're working on it.
Yeah. Yeah. Well, thank you.
I'd like to ask Glenn a question, if that would be possible.
Let me
And
just
so-
say, Nick had said you're pressed because you need to be in court.
Oh,
We need to
okay.
go to treatment court, yeah.
we could keep talking with Glenn. If you want to stay, Nick, you're more than welcome, but if you need to,
I'll head out and then I can watch the recording, or feel free
Yep.
to email me and share my email.
okay.
Okay,
Thank you so much for being
thank
here.
you all. I
Really
appreciated it.
appreciate All
Thank
right.
you.
Take care. Okay, Becky, there you go.
So I was thinking of the priorities that are difficult for Ellsworth, and so the pull between so often the prevention and the deterrence part of those priorities end up fighting with each other. That, you know, taking you know, which comes first, the deterrence or the prevention. In other words, catching the bad guys or the bad things that are happening now. I'm not supposed to say bad guys anymore. Bad things that are being done by people. And then the other thing of, you know, wanting to be part of this. And so it seems to me that it might be easier to find money on one side, but not on the other, that would change those priorities.
Well, yes and no. I mean, you know, quite honestly, I mean, the money that's out there for any sort of law enforcement type of activity, enforcement has, you know, they've rolled back money for enforcement, and they've invested, the state being, has invested a lot of money in treatment and the liaison program and those, you know, those type of efforts. And I think, you know, I think in order to really impact the situation, I think you have to, I mean, you have to attack it from all sides. It's not just a treatment and support for addicts and Narcan and, you know, liaisons. That's all an important piece of the puzzle, but you can't, I don't think that you can, you know, we have examples of it, you know, out west, areas that Oregon that has decriminalized, you know, basically all drugs. And it's a disaster. I mean, it's absolutely a horror show. So I think that there needs to be, you know, efforts continued to put into enforcement as well as the treatment and the support and the, you know, the life-saving efforts that go into, you know, programs like naloxone and things like that. And so I think right now the state's sort of
Position?
taking they're definitely their position, but the emphasis they've put on law enforcement is, we want you to partner with these entities, and we want you to approach these issues from this angle and less enforcement, you know. And I think there's law enforcement needs to be involved with both sides. We need to be involved with the support and the treatment and the life-saving, because that's, I mean, and we've been doing that for years. But we can't neglect the enforcement portion of it as well.
That was one of my concerns. I know when I lived in where was it, Cambridge, and I went to the police department, and you know, the offices that they had to live in, you wouldn't put a dog in, and it just really ticked me off. You know, no wonder they're grumpy sometimes. You know, if you go home to that, you know, the shower is like a 2 foot by 2 foot. It was just ridiculous. And the city, it was a medium-sized city outside, you know, within the Boston, whatever. Anyway, yeah, I would like to see a lessening of the concept that you have to take it from one side and put it to the other. You know, it's just either or mentality. I'd like to see more of it, you know, as a whole, everybody working together. Anyway.
Yeah, no, and we absolutely, law enforcement absolutely needs to be, you know, part of the solution. But you know, total neglect of enforcement for you know, from a law enforcement perspective and from a community perspective, I mean, we're being negligent in in performing our duties. And in many instances, it's not out of our own desire to do that, but in some instances, our hands are being tied and things are being dictated as to what we can and cannot do. And I mean, I'll give you an example. There's, if we get to a scene, an overdose scene where there's, excessive amounts of drugs, indications perhaps of drug trafficking. Perhaps there's other people there who potentially could be charged with with a crime. They're protected, and we can't charge anybody. The only thing that we're able to really pursue in an overdose situation is in a death, where we're encouraged, which is extremely difficult, and to my knowledge, no one has been successfully prosecuted for it in the state. But we're encouraged to try to track down the origin of the substance, and that individual can be charged with some varying level of homicide. But to my knowledge, I don't know of any successful prosecutions of those cases yet. And in Ellsworth, we've pursued several, only to either have the district attorney's office, decide not to prosecute them, or never be able to actually prove the origin. So, and I think that, there's some merit in not prosecuting the overdosed individual. There's some merit in perhaps not prosecuting someone who rendered aid or, called for assistance, in order to encourage that sort of behavior and ensure that, that's done in the future. But when you have other potential crimes, it seems as though it's a neglect of duty on part of law enforcement not to take action, but we're simply just not able to. So there's a push for one side and kind of a steering away from the other side, the enforcement side of it, that makes it difficult for law enforcement and puts us in a difficult situation, because we want to do what's best for the community. And in a lot of cases, treatment and support and life-saving measures, that's what's best for the community. But I think enforcement has a role to play in that as well.
Thank you.
Yeah.
So what would you see as a way, like I understand the piece about not prosecuting the people who have called for help, because otherwise people just run away and don't call for help and then somebody dies.
Mm-hmm.
How would you find the line where, okay, you've seen all this other stuff that's not the person who called for help or assisted somebody? How would you make that be different?
Well, I think through investigative measures on the part of law enforcement, you can distinguish between who was actively involved in assisting an individual, whether it be through dialing 911 or administering Narcan, or and then those individuals who were not actively involved in any sort of life-saving measures. Perhaps they were involved in destruction of evidence, or worse, prohibiting or fleeing the scene or something of that nature. And I think it would require work on the part of law enforcement, but you could certainly, through investigative means, you could certainly uncover some of that behavior anyway. Mm-hmm. And if prosecution was supportive of that, and the state wasn't essentially telling us, no, you can't do that, we don't want you to do that, then I think that would be efforts that law enforcement could put into some of these cases in order to try and again use that enforcement piece to complement the other work that's being done when dealing with the opiate crisis or drug overdose situations, because it's not just opiates. I mean, all the focus is on opiates, but crystal meth is another, big problem in all of our communities in Maine. Cocaine has made a resurgence. So, I mean, opioids is the, kind of focal point because, most of the overdose deaths can be directly attributed to opioids, but they're certainly not the only drug problem, that we face in our communities. And most, if not, maybe not all, I guess you can never say all, but most drug situations are, multi-drug use. It's not just opioids.
okay.
Polydrug use is very, very common, and that, that can't be ignored either. Just trying to address the opioid issue.
Yep. And does Narcan work for crystal meth overdose
No,
or only
No,
for
Narcan-
opioids?
yeah, Narcan only works for opioids.
Mhm.
Crystal, I haven't been involved in any fatal crystal meth overdoses. Typically what you find with that type of situation is that's generally what pushes somebody into a psychosis type of scenario, or and they harm themselves or do something extremely risky because of the drug. But I haven't personally seen any methamphetamine overdoses that were fatal, but for just strictly from the drug.
Yeah. So I'm still kind of stuck on the thing about the community liaisons and the size of the county. And I'm curious how it works. Like if we had that through the sheriff's department, I'm sorry for not being very knowledgeable about this, but are deputies stationed around the county, or when the sheriff's department gets a call, do they go from their office? So the community liaison would be there and go with whatever officer was going out?
Yeah. So right now, the way patrol works for the county is the county's divided up into zones, and I think there's 4 zones, and right now there's call sharing. So, like for example, Hancock and Hancock, Lemoyne, no, not Lemoyne. Yeah, Hancock, Lemoyne, Sereno, Sullivan, all of that end of the county. Right now, the state police is probably covering that. It's zone 3, and that's typically the state police. Hancock gets it occasionally, but more often than not, the state police. And then zone 2 is like Blue Hill area, and that's more often than not Hancock County. So right now, we'll just use those 2 areas for examples. There's probably 1 deputy assigned to zone 2, which is the Blue Hill area. And then there's, 1 trooper assigned to zone 3, which is the Hancock area. So they're generally, when they're assigned to that area, unless for some reason they have to, they're at the sheriff's office for paperwork or something, they're generally in those communities, just patrolling. So if you have we'll say an overdose call in Hancock, the trooper is going to be coming from somewhere, typically inside the county.
Yeah.
But could be anywhere from, that's a Hancock, and that zone is a larger, they could literally be all the way down, and, out on the Korea Peninsula and have to respond somewhere back in Hancock. So the response time is not necessarily the greatest. They're not going to have a liaison with them. So if you had somebody, for example, if you had somebody embedded in the sheriff's department, I would envision that person would be home base, would be the sheriff's office here in Ellsworth. And then when you had a crisis call, that person would be dispatched like an officer from home base directly to that call. And again, when you're talking about Hancock County, you're talking Route 9 all the way to, Deer Isle. So even still, your response time, like with the liaison situation, your response time is still going to be somewhat hampered just by the sheer size of what you're talking about, distance to cover. But
Mhm.
at least if they're embedded in the agency, they have the capacity, you would have the ability to train to have that person go through EVOC training so they could travel in a car that had lights and sirens. So that would, enhance their ability to respond. If you had an officer who could take them, then you have even an advanced ability for that individual to respond quickly. So I think if they're in an agency, I think you have more ability for that individual to be responsive. Not to mention, like I said, I mean, if dispatch calls Nick, who's in Otis or some other place, who knows where he's going to be at the time that he's being called, he's coming in his own vehicle, so he's coming with the flow of traffic. May not be familiar with the area, so he may not know exactly where he's going. So that can be, an obstacle that they have. He or she as a liaison not affiliated with the community has to overcome. And then they're not familiar with the community. They're not familiar with the individuals. We have the luxury in Ellsworth, it's a big enough community, but it's small enough that we know, as municipal police, we know all of the individuals, we know the players, we're familiar with them. So if we had somebody embedded in our department, they would have a distinct advantage over somebody like Nick, who is covering,
Right.
such a massive area with, people that there's no way he could ever truly become integrated into all of these communities. It's just not physically possible.
EVOC training, what's that? EVOC training?
Emergency vehicle response.
Okay.
Operation response. So like all police officers go through it. That's why, that affords us, if you will, the ability with lights and siren to, exceed the posted speed limit and respond. Firefighters go through it, ambulance drivers go through it to varying degrees, depending on, what they're doing. So that's something that, if we had somebody in our agency and we wanted them to respond lights and siren, then that's training they would have to receive.
I gotcha.
And yeah, so I don't know if I answered your question, Shemaya, or not, but I think that it's a difficult situation. And it sounds like Nick has made some, connections with Bar Harbor, which is great. He hasn't made a lot of effort in Ellsworth, just straight up. We do, I think partly that is because, they have the Inspire Center, and we work with Healthy Acadia a lot, with our Project Hope and other things. So maybe, he's kind of gone into the communities where Healthy Acadia is not as involved with, with their, addicted population. Our Healthy Acadia is, with the Inspire Center, which they've turned into the emergency shelter for, they call it a warming center, but it's basically a shelter. They've become even more intimately involved with, with a lot of the substance abuse suffering folks in our community, especially the ones who are at most risk, the ones who are homeless, the ones who are, having in some mental health issues. So they've become intimately involved with and connected to a lot of those folks in our community here in Ellsworth. There's obviously for Nick, there's a lot of work to be done, and I'm just not sure that the program's set up for success with its current model. And I think for Ellsworth, like I said earlier, I think for us, our focus needs to be, we need to get someone doing that type of work into our agency, working directly with our officers on a daily basis, not once a week, but 40 hours a week, and being able to respond. And we're big enough to be able to do that and support that.
Yeah. And I was sorry Tara wasn't able to be here, who's with Healthy Acadia. She wanted to be, and she has a conflict for the next few of our meetings with another training that she's part of. Because it would be great to hear her get to speak to Healthy Acadia's role in this and how are they connecting with what Nick is doing. And I think one of the things we've been trying to do with the LECEC is make a space for a little more connecting, like so that Nick, not having been as in touch with Ellsworth, maybe we can help to start more of a conversation. So the resources that are available, you are getting to connect with.
Absolutely.
Yeah. Well, does anybody have more questions or comments at this point?
Sort of filled up to the brim here. Thank you, Glenn.
Yeah.
That was an amazing amount of information that I had no idea worked out all that way. I've known it in pieces, but not as a unit.
I'm happy to share. I've got lots of it.
It's great. We're so glad you could come today. We super appreciate that, Glenn. And Becky for your questions too. So
You liked my questions?
it's
I'm listening
fantastic.
to them and I swear to God, it sounds like I'm campaigning again for commissioner. I just may, I don't know.
Well, you bring a lot of knowledge about how the county works and how to get things moving within
Yeah.
the county. And
Well, how I wish, I wish they would, but yeah.
well,
Thank you.
because it's about seeing, well, what is the way to go forward? What would be the first way to go forward,
Yeah.
So
Well,
I
I'm not in the weeds like Glenn and Maggie and Tara and, so, I have a lot of time to spend on rummaging around data and running around meeting people and stuff like that. So I think that has its plus.
yeah.
Anyway.
Yeah. And Maggie, I hope maybe this has given you something for resources that are available for folks you're working with or something in that direction.
Oh, it definitely has. I mean, like I said, we have a great relationship with AMHC and Healthy Acadia, but I think having that additional information is helpful to have anyways. And I'll definitely share that with other advocates and people in the organization as well.
That's great. Thank you so much. Well, thank you, everybody. I'm gonna stop the recording here if I can find the button. Here we go. And thank you, everybody who is watching this.